Hello and welcome back to my channel. My name is Dr. Bertha. I'm board certified in infectious diseases and internal medicine, and this is the second part of the video that I'm doing on lupus as we raise awareness about what the disease is, what we can do to diagnose it, how an individual can know that they have lupus, and how the disease is managed and what you can do to show your support for the patients with lupus who are suffering silently. So in the first video, I talked about how lupus even occurs, the whole idea of an antibody attacking the body's own cells, forming complexes and depositing around the body. I also talked about the preclinical phase of lupus, where from about 5 to 10 years, people have these antibodies circulating and they might just present with one single symptom. And then as they add on, finally they get to the stage where the American College of Rheumatology has determined that once you have up to these 4, then maybe you qualify as being diagnosed with systemic lupus erythematosus. And so in this video, I will tell you the skin changes that can occur. We will talk about the central nervous system changes. We will talk about changes that affect the heart and lungs and deal with the rest in another video. So let's talk about the skin changes. So I have this female model here. Since the disease affects women 9 times more, I'll be using her quite a bit. So the first is skin changes that can lead to loss of hair. So patients with lupus can have their hair just falling out in clumps, or they might develop what we call subacute or discoid lupus in the hair, and as it heals with a scar, that area would lose the hair and it will not grow back because it's a scarred off area. Then there's also what is called a malar rash. Now, a malar rash is called that because of the butterfly shape. Essentially, there's a rash that covers this side of the face, spares the nose, and it can be itchy, it can be red, it can be painful, and it heals without a scar, but nevertheless, it suggests ongoing disease. Now, even though I'm going over clinical signs and symptoms, remember what is happening inside the cell or inside the body. The body is reacting to these abnormal antibody tissue complexes that are going around the body. So it's those changes that we're seeing on the skin. Now, in women, at the back of the body, in what we call the posterior trunk, women can also have big rashes. We call them discoid lesions. They can occur on the arms and actually on the trunk or the rest of the body. So just keep that in mind. The other thing that can happen is what we call photosensitivity, where people go out into the sunlight and it feels like their skin is burning. In fact, some people can develop a disease so severe it looks like they've got a big burn all over their body. Sometimes we call it erythema multiforme. They really got these big blisters all over their body. And then in the palms of the hands, as you see in the diagram, some people can develop painful vasculitis or lesions in the palms of the hands. So those are some of the skin changes that can occur with lupus. How about the brain? So I'm going to show you a model of the brain and tell you what happens with the brain. So some people who get affected with lupus can develop psychosis. Psychosis is a condition where people have delusions and hallucinations. Delusions are false fixed beliefs that cannot be changed despite evidence to the contrary. And hallucinations can be things you hear, see. So essentially, these patients develop what we call, in layman's terms, we say they've gone crazy or they're mad and need to be admitted to a mental institution. Lupus can also cause people to have seizures. Seizures are a layman's term for convulsions. They're having seizures, and there can be various types of seizures. In the brain, lupus can also cause strokes. And the reason why strokes can happen is either because they're on steroids or it causes what we call premature atherosclerosis. Normally, before you develop a stroke, the body's blood vessels go from having a nice big opening or lumen to it gets smaller and smaller till it gets blocked. Now, imagining this happening in the brain, the heart, the kidneys, and various parts of your body. So it is this premature atherosclerosis which blocks these vessels that surround the brain that lead to strokes in very young people. This can affect the spinal cord and someone can actually stop walking because of that. So let's look at the heart. This is a human model that shows you the lungs, and in between the lungs you have the human heart. So I'm going to show you what happens with the heart. Now, surrounding the heart is two thin membranes called pericardium, okay? In between these pericardium, which I'm just going to illustrate with a pair of gloves. I'm going to put on a pair of gloves. That's how I show my patients what pericardium looks like. So you have this membrane. I would have put the gloves on the heart, but it's too big. You have this surrounding the heart. The heart is pumping like this, and there's a small amount of potential fluid in between these layers. Now, when these immune complexes attack the heart, they lead to formation of large pockets of fluid in between these two membranes, and so the heart begins to sit in this big sac. Now, you would think it's a sac, it doesn't matter. It can cause something that we call tamponade, where it squeezes the heart to a point where you can't breathe and it can lead to death. Also, when you open the heart, it's made up of muscle and a lining. This muscle can get inflamed. It's called myocarditis and lead to irregular heartbeat and even pain. And then the inside of the heart, called the endocardium, can also get inflamed to the point where the valves can develop these clots on them that can also lead to stroke. It's called Liebman-Sachs endocarditis. And so the heart can really get involved with lupus. And so this year, one of the focus has been on remembering that patients with lupus can have heart trouble. The other thing I want to focus on is the lungs. The lung sits on both sides of the heart. So once again, the lungs are also covered with two membranes called the pleura, and in between them, fluid can also accumulate, leading to what we call pleural effusion. The heart tissue, the lung tissue itself can get inflamed with pneumonitis. There can be bleeding into the heart called alveolar hemorrhage. And so all these things can happen with the lungs in someone with lupus. How will you know? They would have chest pain, shortness of breath, and that can be a reflection of what's going on with the heart. I don't want to forget talking about the bone, because 70% of lupus patients will have some involvement of the bone. I'm going to show you a picture of what happens when lupus patients get inflammation involving their hands. It's so classic. It involves what we call the metacarpophalangeal joints. These joints, they get big and puffy, and you can almost recognize it even in town when you're walking and you find somebody with lupus. They specifically involve the joints of the hands, where patients wake up and it feels like their hands are stiff for more than 30 minutes before they can get going. The hip joints can also get involved with complete blockage of the supply to the hip joint. So it's not really arthritis, but it goes dead. It's called avascular, meaning no blood supply, necrosis of the hip joint, and the hip joint has to be replaced. Almost every joint can be affected in lupus. So in this video, I have talked about a bit more than I planned to. I have talked about the skin changes with lupus. I have talked about the heart. I've talked about the lungs. I've talked about even the bones and the central nervous system. So remember, May is Lupus Awareness Month. Take a picture and share it on social media and let our patients who are suffering with lupus know that you support them. And if you like this video, subscribe to my channel, share the video, and let me have your feedback. And you can follow me at Ajosewa on Twitter, or go to youtube.com/@Ajosewa. Thank you for watching my video, and see you in the next one.